I'm Eric McGovern. This is my patient, and I'm going to be demonstrating end range of motion and end feels on his range of motion. We're going to start out with the glenohumeral joint, get into shoulder flexion. It's about 170 degrees with a muscle stretch, end feel. Shoulder extension, it's only about 30 degrees with a capsular block. Go into abduction, 180 degrees, muscle stretch. Adduction, 50 degrees, capsular block. The humeral ulnar joint, which is the elbow. We're going to start out with elbow flexion, which is soft tissue block because of the bicep. And extension comes out to about 0 degrees with a bone-to-bone block from the elbow. And the femoral acetabular joint, we're going to keep your leg straight and go into hip flexion. And that should be about 40 degrees with a muscle stretch. And the extension back is 30 degrees, capsular block. Abduction, move up a little bit so you don't kick the couch here. It's about 40 degrees capsular block, and do adduction across your other foot. It's about 20 degrees, also capsular end feel there. Radiocarpal, put your hand in neutral position here. Do this pronation, it's about 70 degrees. And supination here is 80 degrees, both capsular and feel. Tibiofemoral joint is the knee, so your flexion, we'll just do that. That's a soft tissue block from the hamstring. And extension, straight knee, it's 0 degrees, and it's a capsular block. Next, we're going to do passive, active assistive, and active range of motion on his shoulder, knee, and ankle. First, we're going to do shoulder flexion. So I'm going to do that without any power of your own. I'm going to lift your shoulder. The passive shoulder flexion, about 170 degrees. Now we're both to do it. Use some force of your own. Alright, same range. Now do it by yourself. Okay. Now could you sit down? Alright, not do anything here. I'm going to get your knee into passive extension. That's fine. Now use some of your force. Alright. Now do it by yourself. Okay. All three the same. Now could you take your shoe off? Get you into passive dorsiflexion right here. Okay, now help me out with it. With active, assistive. Now do it by yourself. Alright. Pause. Okay, right here I'm going to be reevaluating my patient's shoulder extension. I'm going to be measuring this time with a goniometer. Just turn here a little bit. Alright, now move your shoulder into extension backwards. It gets to about 30 degrees, and that's something that needs some improvement. Since he has decreased shoulder flexion caused by muscle imbalances, and he has rounded shoulders. These are evidence of tight anterior muscles and lack of definition in the back. So in order to fix the imbalance, we will use back and rotator cuff workouts, as well as pec stretches to increase shoulder extension.